Okay, this is section three, and we're going to continue our discussion on drug regulation and control. We started looking at this particular label. This is a OTC label, and with many OTC labels, we have the following components: product name and address of the manufacturers or distributor, list of all active and other ingredients, amount of content, adequate warning, and then adequate direction for use. So we were beginning the process of analyzing this particular label. Again, this is a over-the-counter medication by CVS, a generic brand. Children's pain relief suspension liquid, and it contains the active ingredient of acetaminophen for fever reduction and as a pain reliever. And I want you to go to the comment to the left and take a look at it, and we're going to go over this very carefully. It has what's called drug facts. First, it mentions the active ingredient, which is acetaminophen, and it gives the amount. Okay, so the active ingredient as relating to the dosage required, which is 5 milliliters or 1 teaspoon, and so you should find 160 milligrams of the medication there. And then talk about the uses. Okay, it's for the common cold, flu, headaches, sore throat, toothaches, and just to relieve minor aches and pains. The warning: since it contains acetaminophen, it can lead to certain challenges, and so at a very high dosage, it causes liver damage. And then they have what's called sore throat warning. So if you're taking this particular medication and it's not working, and you have a persistent of, for example, a sore throat with fever, headache, rash, nausea, vomiting, it's probably best to consult your doctor. The medication is not working for you. It has a do not use, and it should not be used with other medication because that will add to it other drugs that contain acetaminophen, leading to the problem of liver destruction. It should not be used if the child has liver disease, since it is metabolized within the liver. As a doctor or pharmacist, before use, the child is taking a blood thinner, such as drug warfarin. Acetaminophen also has that particular type of effect, and so if you take this particular drug with warfarin, it can lead to internal bleeding. When using this product, do not exceed the recommended doses, and stop use and a doctor if you find that the drug is not working. And then, of course, the warning of keeping this particular drug out of the hands of reach of children, and what to do when there is an overdose. Okay, so some of the warning is because of the Tylenol situation that occurred many years ago. There's a lot of barrier. Many medications have like a triple barrier. First, it costs the cap. Then, to open the cap, you must push it down and open it. And then there is a seal in front of the opening of the bottle before you can actually get to the medication. So this triple seal has been very effective in decreasing the amount of childhood poisoning over the past few years. And then continuing on with the drug fact is on the left hand column the direction. How do you use this particular drug? So it gives that particular information. It gives it in terms of age and also to the weight of the child. Store at room temperature. This is a recommendation for this particular drug. And then the inactive ingredient. A lot of people don't understand this, that when you see a pill, for example, much of it is not necessarily the medication. because they would have been so small that you cannot really, take that particular medication. But there's a lot of fillers or maybe enhancers or protectors. Like, for example, we're talking about bufferin aspirin, that is a coated that you find around the actual aspirin in order to make it last a little bit longer and not be degraded by the acids within the stomach and actually pass through and get into the duodenum, the small intestine, in which it can be absorbed. So here for acetaminophen, you have the inactive ingredients, and these are many times fillers. And then, since it has a nice tropical punch flavor, there's those particular type of flavors that has been added. And of course, as part of the labeling, mentioning the distributor or sometimes the manufacturer, where they're located, and that particular information. So this is a very good example of an over-the-counter label that you find associated with many of those particular type of drugs. Okay, so let's look at certain definitions. One, you have what's called a pharmaceutical equivalent. So here we're talking about drug products that contain identical amount of the same active ingredient or in a same dosage form. A lot of times associated with generic drugs will have the same type of pharmaceutical equivalent as the brand name. Product labeling, important associated information that is on the label of the drug product itself, but is provided with other products, with the product in the form of insert brochure and other documentation. We talked about that in relationship to the PPI, this patient information, providing information that allows for additional information to be given with the drug. And then therapeutic equivalent, a pharmaceutical equivalent, the same product, it has the same effect on the patient. Okay, so these are just some of the definitions that you should be familiar with. You have what is called the FDA label, and again, this particular label is very, very important in terms of letting the consumer know what they should expect. One, here we're talking about the drug called chlorpheniramine maleate, which is the antihistamine. Its uses to treat hay fever. There's any type of warnings that this is associated with. Not to be taken with other sedatives or tranquilizer. How to use this particular product, or what may occur when using this product, such as drowsiness may occur. Therefore, other sedative alcohol may increase the effect, so it should not be used with this particular drug. And then, since it causes drowsiness, then using machinery and driving may not be the best. Of course, keep out of children, and then out of the reach of children in case of overdose, what to do. And then, of course, there are directions. What to do for children over the age of 12, and adults, what to do with children between 6 and 12, and then what to do if you want to give this medicine to a child under the age of 6. So this is the FDA label format for over-the-counter medication. On page 6, we begin our discussion on behind-the-counter over-the-counter medication. While most over-the-counter medication are not kept behind the pharmacy counter, some are, even if the prescription is not required. And this example of that is ephedrine and pseudoephedrine. And the reason why is because these two particular chemicals can be highly addictive. A lot of times, what people were doing is buying as much cough medicine as possible, and then separating out these particular elements and injecting them, causing a high. So, in order to combat an epidemic that was occurring with methamphetamines, and it's still an epidemic today, but at least this helps, there was a legislature to regulate sale of all drugs that contain ephedrine and pseudoephedrine. We do have what is called exempt narcotics, and these are medications that contain tablet-form ingredients but can be sold by the pharmacist without a prescription to a person that must be at least the age of 18. And again, cough medicine that have codeine in it, and this can be done with the discretion of the pharmacist. Also, emergency contraceptives such as Plan B that has a dual marketing status, and Plan B started out as a prescription, then became a behind the counter drug that you didn't really need a prescription if you're over a particular age, and you can ask for it. And now it's actually being moved to the counter in front of the counter itself. So this is called Plan B, and basically it's an emergency contraceptive with a dual marketing status, which means that it has an over-the-counter drug status and also a prescription status. So under the age of 17, it must be prescribed, but the pharmacist may sell Plan B without prescription to individuals 17 years or older. Okay, so again, exempt narcotics is a term that's generally described to those over-the-counter medication that contains low-level doses of narcotics or narcotic type drugs. They must be dispensed without prescription, but the purchaser must sign a register in order to receive them. And example of that is Perigoric, which is a codeine-based cough syrup. And then we already talked about the emergency contraceptive Plan B, which have dual marketing status, that over the age of 17, if you ask a pharmacist, you can get that emergency contraceptive. On the age of 17, must be by prescription. All right, certain definitions that you should be familiar with. A law of the Combat Methamphetamine Epidemic Act, which limit the sales of pseudoephedrine and ephedrine. The dual marketing status, like Plan B, that have both prescription drug and OTC over-the-counter drug status, and exempt narcotics, medications that can be a habit form, like certain cough medicine, and but it can be dispensed by a pharmacist without a prescription to a person at least the age of at least 18 years of age. This is going back to our first question at the beginning of the class in relationship to how much drug could be given to Stacy. So let's take a quick look at that. It says Mark worked as a pharmacy technician at a local community pharmacy. Some OTC drugs are behind the counter, including pseudoephedrine, 30 milligrams tablet, Sudafed, 30 milligrams tablet, Claritin D 12-hour, Claritin D 24-hour, and Alibert 12-hour. The pharmacist had told Mike he can sell these products to patients, but he has to follow the federal rules governing their sale. So Susan comes in, a 54-year-old regular customer, and asks Mike if she can purchase a 100-count bottle of pseudoephedrine, 30 milligrams tablets. And the question is, how